We're going to go ahead and get started in just a few minutes. We want folks to continue to mingle, eat, get food if you want, get seconds if you need it. I know I'm talking out of turn, so I'm going to have to check with my staff. If they're not looking at me crazy, then I know you can have seconds. But listen, welcome, welcome, welcome. We thank you for being here today. It really means so much for your presence being here, to hear about the data, to hear about what's happening in our community. For me, the most important voice that we could ever hear are the people we serve. And that's why this information is so critical for how Dare to Care is shaping its vision, shaping the work that we're doing in the future, building it now. And so we are excited about what's getting ready to happen today, but more importantly, we're excited about the future. And I'm excited because you're here and you get a chance to witness it, but also you get a chance to be a partner. Because I truly believe that it takes all of us in the community. There's no one nonprofit, no one organization that are going to be able to solve the complex problems that we address with our organizations and with our opportunities and with our businesses, et cetera. So working collectively in a multi-sector approach, I truly believe that we're going to end hunger and we're going to take a stab at poverty. And that's going to happen as a result of what I believe what's going to happen in the future because of people like yourselves that are willing to stand up and continue to fight to make things better for our neighbors. And so we want to thank everyone here. We want to thank our sponsor, the Humana Foundation. They have been incredible. They afforded us the opportunity to be able to do what we're doing. Without them, we wouldn't have had this opportunity. It literally helped to accelerate the work that we had 5 years in advance. And so you're getting 5 years advance information that we weren't thinking about was going to be a reality, but because of the support through the Humana Foundation, we've been able to do so. And again, we want to thank the panelists that are here today, that are taking the time to come and share with us their experiences, not only their experiences, but really share their heart in terms of what's happening and how we can really work together to solve these complex problems. And so with that, I'm going to get ready to take my seat because in my other position and role, I'm a pastor, and it's the worst thing you can do is give a pastor a microphone and a room full of people, because I get excited and I can really talk and talk about a whole lot because I got an audience to talk to, but I'm not going to do that. I'm going to be disciplined today. So thank you, and we're so great to have Crystal Spratt, who's going to be coming up. I want to introduce her. Come on up. She's going to be the MC today. And the next voice you will hear is Crystal.
Hey, well, I guess okay. I don't want to double dutch there. All right. Thank you. Thank you so much, Mr. James. All right, first, before we get started, someone lost a phone. So if you lost a phone, just raise your hand and we'll get you reunited, all right? We'll put it on the table over here. All right, I want to thank everyone for coming out today. I ain't gonna lie, when I saw the temperature and then the snow that we've had all week, I was like, Lord, is this still gonna go on? But he allowed the sun to shine, right? The sun is shining, and this is such a wonderful crowd. And so before we get started, I know some of you are chomping down, but just could you turn to someone around you and just kind of greet your neighbor? That's what today is all about, community. Us coming together, learning one another, and doing what we can to make sure that Dare to Care does what they do best, which is feeding people in our community. I love it. I'm hearing some talking and some hello. How are you? All right. Well, again, my name is Crystal Goodner Spratt. I am a media personality, and now I am a podcaster. And so thank you very much. And so my show is Candid Conversations with Miss Crystal, and it is all about having real conversations, all right? My tagline is transforming through transparency. And that's kind of what we're doing today, right? We're breaking down the data, and we are getting to the heart of the matter. I remember hearing the story about how Dare to Care got founded back in 1969. I'm a storyteller, and a story that reaches your heart I'll never forget. The story of 9-year-old Bobby Ellis, who died the day before Thanksgiving due to malnutrition, and how the community came together, sort of like this, to make sure that that another Bobby Ellis wouldn't happen, not in this community. And so for nearly 60 years, Dare to Care has made it their mission to make sure that the least of these in our community receive food, which is a right, right? It isn't a privilege, it's a right, right? So everybody put your hands together for Dare to Care, though. The wonderful work. And as we know, hunger is not just about food, it's about access. It's about stability and community resilience. And right now, did you know that 1 in 8 people and 1 in 5 children in our region are food insecure? And that's not just a number, it's a call to action. And so today we're going to break down the data, identify the gaps, and discuss actionable strategies that we can all take part in. And so let's get to the fun part. We're going to break down this data. So without further ado, I'm going to toss it over to Mr. Sean Herbig, who is going to break it all down for us. All right? Show him some love.
All right, thanks everybody. I don't normally get a lot of love when I start on a research presentation, so thank you. I'm feeling pretty good about that. And thank you for that kind introduction. Okay, look, I am super excited to be here. I love the idea that we're gonna end food insecurity and then we're gonna take a shot at poverty. I mean, look, what more reason do you need to get up in the morning? We get really excited about this, and as a group of human beings at IQS Research, we've been doing work for about 25 years, a little over a quarter of a century. And I always know that I'm in the right place because we're working on work that is worthwhile. We're working on work that is meaningful. And I believe very, very sincerely that when you have knowledge about a problem, that you will change the narrative about a problem. You will think about it differently, you will internalize it differently, and you will talk about it differently. And that allows us to solve it, hopefully, or at least to make some headway towards solving it. So when you've got knowledge, you can do things. You can do some things differently. And the way we created knowledge in this process is we have this 3-wave initiative. We've been working on this for about 2 years, and we got about another year that we're going to be going in terms of wave 3. But I'll tell you some of the things that we did. So wave 1, that was, if you're a research geek like me, you'll call that's probabilistic research, right? So that's all the math, sort of the survey-based stuff that goes on. We had about 2,000 responses that came in. At IQS Research, we have a stated value that we do inclusive research. So what did we do to make it inclusive? Well, yes, we crossed the digital divide because we had paper. We had it online. We had it in 8 different languages. It was across 13 counties, and we had 51 different partners to make sure that we heard from everybody, not just the normal people, not just the ones that we usually hear from, right? They get their voices heard all the time. We want to hear from everybody, and sometimes that means everybody else. That was wave 1. And they were compensated for their time because we don't take our neighbors' time for granted. Second thing we did in wave 2 is we did some focus groups, right? You guys are all familiar with focus groups. You've heard about these. We did 10 of them. 10 of them, 5 different locations, including virtual, had about 53 participants. Of course, we compensated those individuals as well. For wave 3, that's going to be starting. We'll be talking about that towards the end of the year, and I look forward to sharing more information with you about that. So let me give you the basics, right? And this is not going to be a surprise to anybody in this room. The problem of food insecurity is complex. Again, I know I'm preaching to the choir, but sometimes stating the obvious is valuable because it just needs to be stated. So food insecurity is complex. Why? Well, we've got some things like people making decisions, they're going, look, there just isn't enough food or there isn't enough money to pay for the food that I need. Just out of money before I'm out of days in the month. I'm out of money before it's time for my next paycheck. So I got to make some choices. So we're choosing between things like food and other necessities. I'll talk about that. We're also talking about access to food, right? Access to my preferred food or access to healthy food. Both of those things are difficult. And preferred can mean a lot of things, right? Preferred is, we had talked to a lady and she goes, my daughter, now if you have kids, you'll recognize this story. She goes, my daughter is really kind of picky. I go, really? Tell me about that. And she goes, she will only eat the breading off of chicken nuggets. Now, again, if you have kids, you're like, oh, yeah, okay, I got it. Now, preference might be kind of hard to reach for that individual. But preference in other cases is probably a lot more attainable. And if it was just these 4 buckets, that would be difficult. The problem is it's not just these 4 buckets, right? Because when we start overlaying these things, we start to find out some things like, gosh, about half the people said that they were hungry recently, but they didn't eat. They didn't have food to eat, right? So they went to bed with sort of an empty belly or a partially full belly, and that doesn't feel good. About 2/3 of people said that they had to cut the size of their meals or they skipped their meals entirely. That doesn't feel good, right? About 2/3 of people said they ate less than they felt they should. They had to choose between things like paying for food and paying for medicine, or choosing to pay for food versus paying for rent. And let's just be honest here, right? Let's not BS each other. There isn't really such a thing as paying for food or paying for rent. You got to pay for both, right? You got to find a way. You're just going to pay for both, or you're going to be out on the street and hungry, or versus in your apartment and hungry, right? So it isn't like you can just have some, well, as a researcher, I can say you paid for this, you paid for that. BS. You had to figure, something got cut, and it sucked, right? So we can just be honest about that. Carrying on, we start looking at things like 1/4 of the people said I often or always have the variety and the types of food that I want, which means 3/4 of people didn't say that. Well, that's kind of sucky, right? Because who wants to eat food that they don't want? Then we start to look at other things like presence of meats, presence of fruits and vegetables, presence of grains. It's half or less. That's not acceptable. So fine, so the problem's complex. We get that. I know that I didn't surprise anybody with those stats. So let me say, well, fine, why don't we just do something simple? Let's just give people some food. If the problem is you don't have food, let's just give them food. You hear sort of a similar argument. I know everybody in this room's heard it. When we talk about homelessness or houselessness, well, let's just give them a house. Okay, good, yeah, because that was really the problem, right? So if you've got food and you're having to make these trade-offs, let's just give them food, but what's the problem there? Well, that becomes complicated too. Why? Because of a lack of reliable information. So when's the food pantry open? What documentation am I going to need? Is it open on the hours that I'm available? Do I have transportation to get there? Do I have zip code restrictions? Do I know what those are? And let's be honest when we're talking about access to reliable information. If you are running a food pantry and you have a choice of spending the next $1,000 on food or spending it on updating your website, as a community, what would you expect that food pantry to do? So you spend it on food, and then you got a crappy website. So then we got an information problem. See how it happens? One of the things that gets really interesting here is I'm reminded of a story. I'm reminded of a woman named Stephanie, not her real name, who was in one of our focus groups. And Stephanie was really interesting because she was working a retail job. A young mother, I think her daughter was 9. Don't quote me on that, but I'm going to be roughly right. She had just gotten promoted. She was a manager now at this retail job. So that's kind of cool. She was getting more hours. She was getting more shifts. One of the shifts that she was getting happened to be on Thursday during the day. I think it was like 10 to 5 or something like that, right? Guess when the pantry was open that she used to go to? Like Thursdays from like noon to 2. So it's great because Stephanie's moving ahead, except now she can't get food, right? And think about that in a week like this, where we probably had some days open, we probably had some days with the snow that maybe Stephanie didn't get those extra shifts because maybe her store was closed. And let's be honest, everybody's heating bill's higher right now because it's colder than the devil out there, right? And now you're home all day. I mean, this is the reality of it. So she's trying to do the right thing. She's trying to move ahead. She's trying to do all these great things that we would associate with the American dream. And yet, one step forward and 3/4 step back. Well, we go, okay, fine. Let's make it a little bit better. Let's talk about health. Cool. So we started asking people about, in your household, do you have the condition, or somebody in your immediate household, somebody for whom you're providing food, somebody for whom you're providing love, do they have these conditions, right? And so we know as an American population, of course, Dr. Taylor, you know this probably better than all of us, as an American population, we're not super healthy, but probably our numbers are a little better than this. 69% of people stated that they or a loved one in their home were diagnosed with hypertension or high blood pressure, right? A lot of people. Diabetes, 40%. When we start talking about good health days or not good health days, 1 in 4 people say 20 or more bad health days or not good health days, either physical bad health days or mental bad health days. To put that in perspective, it's the 20th of February. So every single day we have lived in February would have been a bad health day mentally or physically for 1/4 of these people. And you go, cool, let's just give them some food. Let's just give them food that matches. Do you have these foods? Are you interested in these foods? And this is another interesting point, right? The one that I'm drawn to, look down here. Are you interested in low sugar / diabetes friendly food? 25% of people out of that 2,000 who answered the survey said, yeah, I would be interested in that. But 40% of people indicated that they or a loved one have diabetes. Now, if we're all pretty good at math, you can recognize that 25% interest is much lower than the 40% who actually have the need. So you go, okay, so what's the problem here? Is it an education? Is it I don't know how to prepare it? Is it doesn't taste good? Is it I don't know how to prepare it so it does taste good? You know, the low salt green beans taste really good. All you got to do is add a bunch of salt to it. I mean, what do we have to do, right? So is it an education issue? Is it an access issue? What do we need to do, right? It isn't just a matter of handing them a can of low salt green beans. And let's be blunt, that isn't even easy, right? Cool. So we got some problems. We got some challenges. We got opportunities. So you might be wondering, but what's it like when you get on the floor of the pantry? So we spend a lot of time talking about this, and I think this is really important. And so here's what we say, right? So many participants reported being treated well or being treated fairly by the volunteers, right? There's a lot of volunteers at the food pantry. And so what does many mean? Because many is kind of an ambiguous term. Well, it's about 5 out of 6, right? It's about 82%. Now, here's what's interesting. When you look at the 1 out of 6 who aren't treated well, it's really kind of insidious what happens, right? And I'm sort of reminded of the story of one of the guys who's in the virtual focus group. His name is Jesse. Right, now I just want to paint a little story for you, paint a little picture of Jesse, right? Because I grew up in Fern Creek, so I feel like I can use this term. Jesse he's a big old country boy. If you grew up in Fern Creek, you might just know what a big old country boy. He had a long beard. He's just a big old dude. He was awesome. He was we learned so many things from Jesse, and I'll tell you what, if you judged his book cover, you would totally miss the content of his book, right? He was so easy to misinterpret. Because here's one thing that you might not think of when you think of a big old country boy. Jesse's partner identifies with gender-neutral pronouns.
Yeah.
So Jesse and his partner were in one of the food pantries, and they were getting their box on their regular schedule, doing their standard thing. One of the volunteers didn't honor, let's just say, his partner's pronouns. Didn't seem like it was a huge deal, but it was a slight. It didn't go well. I don't think it was a big kerfuffle or whatever, but it didn't go well. And Jesse didn't feel respected. His partner didn't feel respected. And I believe he was living in the 40202, or they were living in the 40202 zip code. And there were, as I remember, about 3 food pantries that they had access to. So what Jesse said is, I won't go back there. And I sure won't take my partner back there. So now with limited access of being only 3 pantries, it became limited access with 2 pantries, because when the choice was be respected and have an empty belly, or be disrespected, he said, I will be respected, and I will have that empty belly if that's the choice I have to make. And by the way, that was a standard theme across the people with whom we spoke. Respect is important. And if they are disrespected, they will not go back. And they know, they're smart people. They know that means that they're cutting down their access to food. They will not be disrespected. And I don't know that we would necessarily blame them. So one of the recommendations is a call for improved volunteer training, ensure equitable treatment for all participants. But you know what? Here's the thing. You could work on that so hard, and I could come back here in 5 years, and that would still be the number 1 item, right? Because it's just hard to do. And 82% is probably a good number. It just is never good enough, right? If it was 92, that'd be a really good number, but it still wouldn't be good enough. Because that one person who's disrespected, that stings, that hurts. But if we go on with that and we say, okay, fine, but what about the food that you're getting? There's some real opportunities here to think about some things differently. And maybe this is part of the conversation that we can have tonight is about how do we tackle some of these things. Because when we look at things like fruits and vegetables, man, we all know those don't last very long, right? And there are issues there. So that becomes a problem where people are going, okay, well, I'm kind of throwing away some moldy stuff, or sometimes I throw away the whole basket of strawberries. Sometimes I can pick through them, you get the idea. But then we start to see other things like a lack of variety, lack of cultural alignment. I cannot tell you how many conversations we had about lentils. Would you please raise your hand if you like lentils? All right, there you go. All right, Ursula, you got it. Do you see how many hands were down? Here's what I have found out in my own personal experience. People who like lentils love lentils. People who do not like lentils do not even talk to them about a lentil. They do not want to know. They do not prophesize or proselytize to them about, they don't want to hear it. Don't be preaching about lentils. They don't want to know it. So that alignment for what people are used to. And here's the thing, within this community, there are parts of this community that love lentils, right? And they want lentils, they kind of crave lentils. So it's how do we get the right food to the right parts to the right people? If you're Jewish, maybe that pork's not such a great option. And those are like real scenarios, right? So it's this alignment of variety. It's just a cultural alignment. It's the cohesion in the ingredients. We had so many people who said, you know what? I got 4 boxes of beef broth. How much soup do you want me to make? And I don't even have any, I can't make a meal out of what's in this box, right? So just some real issues. And then here's the thing. So we asked this question. In the boxes you're getting, how much of the food can you actually use? Consistently, it's about 40%. About 40%. And it's so great. People say, look, I don't throw it away. I don't want you to get the wrong idea. I give it away. I've got neighbors who do this. And not those lentils. Don't even talk to me about those. But like those boxes of beef broth are like, look, I got 4 in the closet, but like I can give some to my auntie or I can give some to my next door neighbor. And give some. It's a challenge, but I think we would say with all the effort going in, 40% is not the number that we want to achieve, right? Last thing I want to leave you with is I want to talk a little bit about a sense of community, because it at least to me and to many on my team, was a little bit humbling. When we were working in the focus groups, we would get into these conversations, and you guys may know this, but if you go to Kroger and if you like bag salad, there's a hypothesis that if you go to Kroger on Monday or Tuesday, that bag salad's 50% off. Because they bring it in for the weekend sales cycle, and if it doesn't sell, they mark it down. So if you're food insecure, you are going to have to go to the grocery to offset some of what's missing in the box. And if you like salad, go on Monday and Tuesday. If you got a car, if you got gas, if you got all those other things. But if you can do it, Monday, Tuesday is the day. And by the way, we found that out in one of the focus groups. That was a nice conversation. By the way you keep that fresh, put it in your fridge, leave it there, put it on its side, not flat, put it on its side, and then rotate that about once a day. It was a big conversation that we had about how to take care of that. Another one, by the way, if you're in coming out of an abusive relationship, and you're a mother, and you have a couple of daughters, a couple of teenage daughters, and you're in your first permanent housing now, coming out of that relationship, and you're sharing 1 bed and 2 couches. Sorry, 1 bed and 1 couch. I got that wrong. School counselors can be a great source for additional furniture. Now, I don't know about you. I didn't know that. But somebody did in one of the groups, and they also knew other things like which pantries had zip code restrictions and which pantries didn't have zip code restrictions, where you could exert a little bit of agency in terms of your food choice and where you couldn't. And at every single focus group, at the end, we literally had to modify our timing, because some of these times, like the groups are saying, like, look, you got to be out at the end of your time period. We had to modify our time period so that we'd finish early, because they had group texts that they would start. People are writing stuff down. Okay, wait a minute, who's that again? Okay, I need to write that down. Where's that pantry? Okay, and that's in J-Town? Okay, all right, I'm gonna look that up. The sense of community was humbling, but it's real. So when we think about how to tap into this information gap, there's a community out there. It's very fluid, it's not very formal, but it is very real, and man, they care. They absolutely care. I could go on and on. There's a ton of information. I saw some pictures. I don't know if the slides are going to be available afterwards. They'll be available afterwards. So if you've got some notes, you can get some more slides afterwards. And these people all have stories that will back up everything I say to give you more information. And I'm going to turn it over to them now. Thank you.
Great job, Sean. Aren't y'all glad y'all gave him some love? Sean, that was so interesting. Let's give Sean a hand again. That was wonderful. There were so many parts that stood out to me. Anyone want to yell out what part stood out to you the most from the information that he presented? Anybody? Anything that stuck out to you the most? Yes, ma'am. Zip code restrictions. Yes. Anybody else? Yes, ma'am. 40%. Yes, that stuck out to me too. Also the lentils. So this is interesting information. And so we're going to start our panel discussion. Why don't you guys slide over here so you can get behind the microphone. And someone might have to share, or I can give you my mic. But we've got a couple of questions. We're going to do a panel discussion. And then we're going to allow you, the audience, to ask questions as well. All right, Sean, since you gave us the information, we've already looked at the data. I want to ask you a question real quick first, and let's see. You'll share? Okay, all right. You and Ozzy, y'all be best friends tonight. All right, so you presented the information. So tell us how we can use the data to better target resources and solution. You've done the study, we've got the data. What's the action plan, or what should be the action plan?
Well, the action plan is going to come up from you guys, so we don't know yet. What I would encourage you to do, and I think what the data say, is think about usage, whether we're talking about spoilage, whether we're talking about alignment for health, whether we're talking about alignment of food for the need. Think all those things under the umbrella of usage of the food itself. And then the other big umbrella that I would think about is access. How do we get that to people at a time that's convenient for them, that works for them, that meets them in their neighborhood, in times when they're not working, that they don't have to choose between childcare and going to get in the food box, or going to work and getting the food box. But if we think about usage and access, it's still going to be a complex problem, but those are the two biggest buckets that I think we ought to focus on.
Usage and access. And you said when you boil down everything, those are the two things that stick out to you the most. Going back to the information, let's talk about the numbers. And the latest map, the Mill Gap study, shows that there is a sharp rise in food insecurity. And sadly, we're hearing there are layoffs. People are losing their jobs across the country. And when I was working at the news station, I would go to one of these food pantries, and they say that they can barely keep the food in because the demand is so high. So, President James, the question is, as the leader of Dare to Care, can you help us understand what's driving the increase and what it means for families here in Kentuckiana? Why is the demand so high right now?
Well, thank you, Crystal. Before I do get started in response to that, I do want to recognize my incredible team at Dare to Care, because we couldn't do what we do without the incredible team that I get a chance to work with every day. So I would ask if they would stand. And I also want to recognize my board chair, Al Cornish, who's sitting in the back, and I'm so glad that he's here. But the Dare to Care team, if you all would stand, don't be shy. And the reason I wanted them to stand, not only to recognize them, but some of the things I'm getting ready to say and talk about is really critical because they're driving it. We're hearing from our neighbors, we've been hearing, and they're putting together systems and plans, and you're going to hear some other things that we've been doing, but we also are still learning. And so one of the things we've seen is sort of this perfect storm that has arisen. After the pandemic benefits had concluded, you had no more child care tax credits, you had inflation taking place. All of a sudden, you had this perfect storm where folks who were in an okay situation, because we've seen what can happen when resources are given or provided for families who are in need. When those resources are taken away, all of a sudden you have an escalation of food prices that you're seeing, gas prices, even people who are working every day. We have what we understand and know as the working poor. People can't afford, they're working every day, but they can't afford to buy food. And so they're making choices, life choices at the gas pump. Do I get gas or do I go get food? And so what we're seeing in terms of what is happening, it is a direct result of policy that is impacting our neighbors. When you talk about poverty, you also have to address policy, because policy drives a lot of the things that we're seeing in our community. It is not just one level, and that's what Sean was speaking to as it relates to the complexity of the problem. It is multi-layered, but it's solvable because we know the challenges. We even know how much is needed to resolve food insecurity in our community. It's $40 million a year that can resolve for families that are in need now that can solve food insecurity. That's a big number. But the way that we have to look at it is that we have to look at it from a collective perspective where, again, that we are addressing policy, but we also are addressing individual concerns and needs as well. And so it gives us an opportunity to be able to cast the net wider, but also be more intentional and deeper and going deeper with the work that we're doing.
All right. And we brought some powerful voices from our community to help with this conversation. And I'm just going to go down the line and allow you to introduce yourself.
My name is Shane Schlater. I'm the Executive Director for Exodus Family Ministries.
I'm Dr. Mona Lisa Taylor. I'm a primary care physician with Norton Healthcare, and our office is actually down the street off Barrett Avenue.
My name is Ozzie Gibson. I'm the executive director of TARC.
Got another one.
Being,
All right. Well, Minister Shane Slater, and you are a faith leader and you operate one of the pantries. And Sean, your story about Jesse really stuck out to me. So, as a faith leader operating a Dare to Care food closet, how have you seen the role of churches evolve in the fight against food insecurity? And what unique challenges and opportunities do faith-based food pantries face?
So we've been involved with having a food pantry for going on 5 years. And I think what's difficult is the need has changed so much during that time. You're constantly trying to adapt to that need. And it's hard to keep up. I know some of the slides showed, the need for things like fruits and vegetables. Well, for a pantry, you may not have a lot of resources. And so for us to take on more fruits and vegetables, we have to have the refrigeration for it. And that was a barrier we faced for a while. We couldn't take on very much because if we did, then we dealt with the possibility of it spoiling. And so thankfully, I will give Dare to Care a shout out. They provided a grant that gave us an opportunity to get a combo refrigerator and freezer to be able to store those items. And so it's constantly a challenge. A lot of our clients now are being unable to make it to the pantry, so we're having to figure out what are ways that we can take the food to them. So there's a lot of just changing, and there's a lot of adapting, and there's a lot of us trying to get the resources we need to be able to meet that need as well. And so I'm thankful to be here and for the opportunity to be able to see this research, because this helps us to get the support we need to be able to fight back against this. So I'm really grateful for Humana and Dare to Care and the research that was provided by Sean. So thank you all for that.
Minister, so what are some of the things that some of your clients tell you, and are they also expressing that they only use about 40% of the products in the boxes?
So about 2 years ago, we started looking for ways to raise money to supplement some of our boxes. So thankfully, Dare to Care does provide an opportunity for us to purchase some items at a discounted rate. So we do that, as well as purchasing items at different local grocery stores. So we try to figure out what we know we're going to have for a month, and then whatever we know we're going to be lacking, we try to actually purchase that food ourselves. So if we know that we're going to have a lot of spaghetti noodles for the month, that's not really going to help people unless we can purchase the pasta sauce or something to go with it, so that it actually becomes a meal that a family can prepare. So we try to be creative. We look at what we know we're going to get. And it's hard for Dare to Care. It's hard for us. You don't always know what people are going to donate. And so that's a factor that we don't really have the benefit of knowing. And so you just try to plan the best you can. But we do get, there's always complaints that, maybe we have the spaghetti and spaghetti sauce. Well, I don't have any ground meat. I don't have any. So there's always a need, and it is hard to address it.
Bless you for everything that you do, you and your team.
Thank you.
Absolutely, absolutely. Dr. Mona Lisa, as a physician, you see firsthand the health impacts of food insecurity. And so can you speak to the ways that poor nutrition affects short-term and long-term health outcomes?
Definitely. That's a great question. As we were looking at Sean's data, one of the quotes that came to mind for me is that I had a patient who looked at me and said, high blood pressure and diabetes are a result of poverty. And it was just a simple sentence. And it's probably obvious to all of us right now, because we're sitting here listening to this information. But that was what her explanation was for her diabetes and her high blood pressure, was the fact that she's been living in poverty for a long time. And that is something that I see for a lot of patients. If you don't have access to healthy food, if you don't have access to finding things that are low in sodium, that may cause you to have higher blood pressure and diabetes. If it's hard to get your medicines and you have to make the choice of, do I pay for my medicines or do I pay for a meal? You're not going to buy a medicine. You're going to get food because you need food. food is important. You need to feed your family. And so being food insecure puts people at higher risk of these types of conditions and also malnourishment. We've heard of scurvy. I know it sounds like a pirate disease that we don't see very often, but it still exists in our communities, especially if people don't have access to foods that contain vitamin C, or they have some other condition, maybe a gastric condition. I've got a lot of patients with nausea, vomiting, diarrhea issues. I know that doesn't sound too pleasant as all of you are eating, but as a result, it's hard for them to keep food down. And we've actually found that they've had vitamin C deficiencies. So this is very present, very real in our communities.
Wow, thank you so much, Doctor. And when we talk about access, I think a lot of people take for granted that they can just grab the keys to their car, jump in, and go where they want to go. There's a lot of people in our community that does not have the luxury of transportation, and that's why we brought TARC to the table to talk about transportation and access. And so, as we say, transportation is often overlooked barrier to food access. And so, Mr. Ozzie, how does TARC play a role in ensuring that those experiencing food insecurity can get to grocery stores and food pantries?
Well, when I started reading some of the stuff you sent me, the first thing I thought of is if they don't know how to know where a TARC stop is, if you can't give me names, but if you could get me data on the addresses, I could do a heat map and we could overlay that right on top of all of our TARC routes and create a pamphlet for you all to be able to share. That was the first thing I thought of, is that's an easy way. And then the second thing was when I started reading about the people, maybe with a medical issue, do they qualify for paratransit? Which at that point, we could easily give you all stuff when you pass that out of what it takes to be registered and how they go about that process. So that was the two quickest things I thought of. So if we can share data and I can download it in our system and do a heat map of where people live versus our routes. We're right in the middle of redesigning all of our routes, and there's a possibility there to make room, or at least your people that, are registered would know exactly where a TARC route is.
Sean, let me ask you this then, while we're talking about access and transportation. How big of an issue did you foresee transportation playing in access to the pantries?
It's a huge issue across the board. I don't remember the exact number, but I'm wanting to say about 50% of the population indicated that as being one of the barriers that they're dealing with.
President James, you talked about policy, okay? And what policies or funding strategies should be prioritized to combat hunger in Kentucky?
One of the things I would say, no cutting of SNAP benefits.
Hand clap goes right there.
Some of the things that we're hearing and some of the things that we're seeing, we know that SNAP benefits help to equalize families that are struggling and have difficulties in terms of making those decisions. And that's also a way to get to address food insecurity as well, along with the work that Dare to Care does. So I think, we have a lot of opportunities. We got to have the political will to make that a reality. And that's, unfortunately, sometimes we don't see that, and sometimes we do see it. And I think that it's the people, it's the voice of the people that has to be spoken and it has to be heard, and that we have to make sure that things are changing. And so I don't see this as a hopeless situation. I'm a very optimistic person, but I'm also a very realistic person. In knowing that it's going to take a lot of work, but it's going to require all of us together collectively, a multi-sector approach, where you're talking about some of the sectors that we even have here that are represented. That's what it really means in terms of having a collective impact to be able to address these issues. So I think we have some opportunities.
Absolutely, and opportunities of doing events just like this. And this is your first time doing something like this, but how y'all like it? It feels good? Yes. Sean, staying in the vein of policy, based on the data, what policy changes do you think could make the most significant impact in reducing food insecurity?
Those questions normally go to
Oh,
Mr. James. And that will be my answer.
okay. Great job. Great answer. Great answer.
Candidly,
Uh-huh.
just take on anything. I mean, I don't mean to be lazy about it, but I was going to be blunt. When you're talking about a complex issue, don't let great get in the way of good. I mean, shoot, you could do darn near anything and start to make a difference. So do something, right? And I would say that there are better things to do that will be more impactful and less impactful, but nothing has no impact, right? So I would say the biggest thing is let's just start moving.
Absolutely. I like that. Let's just start moving. I'm going to go back to Dr. Taylor. How can we, so we've got the data, we're having the conversation. How can we better integrate food access into healthcare solutions to prevent diet-related diseases?
That's also a great question.
Thank you.
It's something that we're doing at Norton Healthcare is trying to focus on social determinants of health. And that's where we've realized food insecurity, this lack of access to transportation, to the doctor's office, to your pharmacy, that all has an impact on your health. Heck, if you don't have a place to live, that also impacts your health. And so we've made it a point to ask patients when they come in, before they get room to see me, hey, do you have any concerns? Is your housing situation okay? Is your food situation okay? We ask them those questions. If our patient has been to the hospital, our nurses are calling them afterwards to make sure that they don't have any other concerns when it comes to food, housing, transportation. And that's helped us address some needs, help point them into the direction of some food pantries. For some other patients who come out of the hospital who have Humana Medicare, they actually get access to some meals that Humana will send them after they've come home from the hospital. So those types of aspects have really helped us in making sure that patients get what they need. And I know in the Norton Healthcare system, for all of our pediatric offices, we actually have multiple food pantries in those locations. So if a family comes in, they need food, they can help while they're there. And the last thing I'll bring up, down the street from Norton West Louisville Hospital, which also has a partnership with Dare to Care and a pantry on the second floor that anyone can walk in and access food. And so we're trying to make strides in this area. Obviously, it's going to take more time, but we recognize if the decision comes to your health or food, you need the food.
That's right. That's right. Thank you so much, Doctor. And Minister Schlatter, you are our connection to those that benefit from the services from Dare to Care. And a lot of times it's, we see the data, we see the names, but we want to hear about the real people. So could you share with us a story of how what it is that you're doing, what it is Dare to Care is doing, is making a real difference in your community?
One of the probably biggest differences we see is with us delivering food boxes to homes. We see the most desperate need in those situations because typically food is just kind of the tip of the iceberg because they're hungry. And so that's the first thing they can think about. And there are a lot of times, I think a quote that was used for this event for me, we had a widow that was elderly that was living off of vegetable soup. She would water it down and eat one can of soup every several days. We walked into situations with someone that was housed, that was living on the street. They ended up in housing. They got very limited SNAP benefits, and it's a great thing to have SNAP benefits, but if you don't have a grocery store in your community, then you're gonna go to the gas station, and you're gonna get food at the gas station because it's close, and you can't necessarily make it anywhere else. And so you talk about the quality of the food you're going to get at a gas station. It's going to be things that you shouldn't eat, but realistically, that's access. This gentleman had neuropathy from diabetes. He could barely walk to the door, so I don't know how he would make it to anywhere to get food. And when we first met him, he had been living off of peanut butter, which, if you're a diabetic, it's not ideal for weeks. So these are situations that we encounter all the time. I mean, we see hopelessness. We see people that are unable to make it out of their home. If they can get on a TARP, which is a great possibility, and I'm not knocking that at all, but if you're a single mom and you've got young kids, how many bags of groceries are you going to be able to transport while you've got a kid in one arm, another kid in holding their hand, and then you're trying to shuffle bags of groceries? How many groceries can you carry? And so there's a lot of issues out there. And thankfully, we are able to keep the food that we can. I mean, we've seen the need rise. Last year, we were serving maybe 900 people a month, and now we're seeing about 2,000. And we went from 90 deliveries a month to over 300 within a year. And if it wasn't for Dare to Care and some of the local stores, we wouldn't be able to meet that need. We couldn't keep up with the growing need. So, yeah.
President James, how does it make you feel when you hear stories like that?
You know, I feel sadness and also excitement. You know, I'm sad about the fact that people are having to live in those kind of conditions. But that's the reality. That's what we see, and that's what we deal with. The excitement is that we have people that are addressing it, and that we're not just looking at it, just typically looking at it from a traditional standpoint of where a person might come to a food pantry and get a box and go home. But many things that we're looking at, and some of the things that we're doing at Dare to Care, is client choice, a choice model pantry where individuals have the opportunity to go and select the kinds of food that they want. We also are addressing some of the issues around health outcomes with food is medicine. We've had pilots in terms of where we've been working with gestational diabetes patients and providing them meals that is cooked in our community kitchen. And so when I see all of these things happening and I hear the data and I hear, you know, the different things that we're doing, we are marching and, you know, moving forward to be able to address the problem. But it is so complex, again, that it's multi-layered, but you have to take, just like an onion, you take one, you know, peel at a time. You have to just continue to peel it back. Because when you do that, you can really get to the core and address the real issues that are taking place. But until then, we have to have food pantries. We have to have Dare to Care. One of my sayings when I first came to accept this role is that I literally want to build out a system that puts myself out of a job where Dare to Care is no longer needed. And so in building that kind of infrastructure, the first thing I did was build a team that I knew had capacity to begin to vision and dream about that possibility. But more importantly, we needed to hear from our neighbors in terms of what we're hearing today, what we're hearing in the statistics, because that's really where the rubber meets the road, where you're addressing real problems, not made-up problems or imaginary problems or problems that you think are problems, but really problems that people are having. So when you talk about transportation, how do we get access to that? So one of the ways we're thinking about that is in terms of how do we provide different sorts of delivery services, and how do we partner with large corporations to be able to provide those kind of services. Those are opportunities that we are looking at, and with this kind of data, we're able to address it very specifically, and it's really exciting.
Now let's hear from you. I'm going to take a couple of questions from the audience. Anyone have a question? Any questions? Okay, I'll come to you right here.
I volunteer for this choice. And so the two of us like in these spots. And
I'm going to come over to you with the microphone. I'm going to
I'm
be like Oprah today, all right?
Okay, I've been volunteering in a choice pantry for 4 or 5 years now. I don't remember which one. And I think I look at lots of different things. I look at the access piece in terms of time. And we're open from 10 to 2:30 every day of the week, 5 days a week. But what's happening is our volunteers are aging out. So it's like we can't extend hours because we don't have volunteers to staff. So that's a concern of mine, is how do we generate enthusiasm for volunteering during work week times? You know, I think we get more help on weekends because people are free, but that's one thing. Dental health is another big piece. More and more people can't eat the stuff we've got on the shelf because they have no teeth. And it's really embarrassing to do that. If the government would stop getting us so damn much pork, which is not just a Jewish thing, it's also a Muslim thing. And I can't tell you how many people don't eat pork. So that's another concern of mine, is like, can we get food that matches people's needs? And then it's matching food to the kinds of things people can cook. You know, have you ever tried cooking lentils on a hot plate? You know, and that's what some of these people are cooking with. So I got concerns about volunteerism, matching food, dental health, and more people to help, so I get tired.
Right. The lentils again. But that was an interesting, black beans? Yeah. But that's an interesting thing. Volunteers. She said their volunteers are aging out. How do you appeal to the community? What is your, Minister, what is your tactic? How do you get volunteers? How do you retain them? And do you have any ideas?
So thankfully, Dare to Care has taken an initiative. I'm actually in a new group for partners to discuss volunteer opportunities. So I know that that is something that's real, that a lot of other food pantries are facing. I know it's not really instilled in generations down the line to volunteer as much. And so we are actually opening up opportunities for our own guests and clients to volunteer, and they love it. A lot of them want a sense of community. They want to belong to something. They've just never been asked. And so we actually have a lot of our clients that have now stepped up. They're volunteering. We are going out to sober living houses, giving them an opportunity to serve and to step up. So we're picking up at sober living houses. We've seen a huge influx in our Hispanic population. We even have a lot of our Hispanic guests that are now stepping up to help translate. So I think it's a matter of giving people an opportunity, but it is difficult, and you have to be a lot more resourceful, I think, than you've ever had to be to get volunteers.
Yeah, absolutely. Go ahead, President.
One of the things that we've seen, and I'm so glad that I just saw Elaine walk in here. She's our director of volunteerism. One of the things we did, she created this incredible opportunity, because one of the things we saw, we have a lot of volunteers that come to Dare to Care, that come to our 3 facilities and volunteer. But we also saw the greater need that's in our community from our partners. We have over 300 partners. We serve in 13 different counties, 5 in Southern Indiana and 8 in Kentucky. So throughout all of those, we also understand that there's a need for volunteers to be at these individual partners. So what we're working on, and Elaine had this brilliant idea to have what she called a food fight. And really what that was is to take volunteers and disperse them throughout the community to our partners, where they have an opportunity to be able to provide services that they just couldn't do on their own, but they can do it when the community comes together. And that's something we are looking in terms of opportunities to be able to expand, because it's not just about putting more food out. You also have to make sure that there's capacity as well as the food is going out. So you have to work at the challenge simultaneously to address it, because otherwise you're going to have a warehouse full of food and no place to put it. And so doing that and providing access to volunteers through Dare to Care, I think initially when she arrived, we had over some 9,000 volunteers. That number has just skyrocketed as it relates to volunteers, from corporate volunteers to individuals that come weekly and they come faithfully. But being able to help our partners, that's really critical if we're talking about building out the infrastructure and the systems that need to be in place to be able to really distribute the food the way it needs to be distributed.
Wow, great information. Thank you so much. So we've got your minds warming up. What we're going to do right now is we want you to get together with people at your table. We're going to do a breakout session. And what we want you to do is kind of discuss some of the information that was broken down for the survey. And then one of you nominate a speaker at the table, and then that person's going to be responsible for asking a question to our panel. So let's take about 20 minutes. Mm-hmm. About 20 minutes. You think we need about 15 minutes? And go ahead, talk amongst yourself, nominate someone to be your speaker of the table, and then we'll resume this conversation. All right, that is our time.
Much better.
Oh, yeah.
All right, we're going to get back to the conversation. If everybody could find a stopping point.
Clients that don't have.
I want to thank you for taking that time and coming up with some questions. And so has everybody appointed someone who's going to be the leader for your group? All right. Panel, are y'all ready? All right. All right, let's start with table 1 here. Miss Brittany, come over to you. Do you want to stand up? You can. If you don't want, you don't have to. All right. She said, I'm okay. Go ahead.
We have a question for Ozzy. You were talking about doing like a heat map with addresses and TARP buses, but could you use those zip codes and make a map with pantries and TARP bus stops and be able to hand those out so that way people can see this TARP stop is the closest to me, like if they're at work or at home or whatever, and then they can figure out the pantries from there?
Absolutely.
Good job, Group 1. I like that. You said, Ozzy, you said that's doable?
That's very doable. Very doable.
Yeah, this is what it's all about. Let's go over here to this table. Who's the representative? Yes, ma'am, Miss Kathy. Kelly.
So it's not prepared because we talked about everything but what we were going to ask. So I just shared, probably TMI, but I shared with them that I'm on both sides of the spectrum on this. I've volunteered with a group called NPHC, which stands for National Pan-Hellenic Council. We are an organization of organizations of fraternities and sororities, African American, the first 9. So you may have heard of Divine 9. We partnered with Dare to Care for the Agape Day of Caring, where clients came through with their trucks up and we physically put donations in their truck. That led me to really getting to know Dare to Care when I needed them myself. Pandemic was hard. I caught COVID twice. I had 2 heart attacks. I didn't know where to go. And I was basically a victim of that zip code thing. I showed up, popped my trunk. They saw Oldham County and they said, this isn't your spot. You should go to Grace. So, and I said, I don't even know where that is or what that is and what that has to do with me. And so it's hard enough getting off your high horse and conjuring up the nerve to ask for help, but to be turned away when you finally ask and you say, well, what am I doing wrong? And who do I need to talk to? And where do I need to go? But what I can say is there's always hope if you keep pushing. Mr. James does not know this, but Dare to Care saved my life. I was forced off of unbelievably great insurance when I lost my job to Medicaid without asking for it. But Medicaid partnered, actually Anthem Medicaid partnered with Dare to Care, and they sent diabetics to the community kitchen, Cooking Matters. Cooking Matters showed a group of us how to cook. We didn't know at the time that what we had in common was we were all diabetics, but they don't tell people why you're there. I learned how to cook. I already knew how to shop. I know about the perimeter of the grocery store. I knew all that. But the other people didn't, pretty much, they didn't know that. But the beauty of that program was besides us being proactive and show, all we had to do was show up. That's all we had to do. 6 weeks, show up. We learned how to cut stuff up. We learn how to do cleanliness in the kitchen. Some people don't wash their hands and they thought them that. But no, I mean, I'm serious. But we learned all that stuff. And then at the end of the day, they partnered with Kroger's and gave us a bag of groceries to mimic the ingredients of the 2 things that we cooked that day. That gave us I had an S on my chest when I went home. And I actually was like, hey, look what we cooked. And then you cook it and you say, hey, how was it? And it tastes the way you cooked it, right? So it encouraged us. And I'm not afraid or ashamed to say that I did that. But then I went to another facility that I don't even know the name of it, but it's not too far from here. 17 people registered. 4 people showed up. 6 people the first week, 4 people the second week. And they said, I don't think we can continue. But to your point, they had called the people that didn't show up to find out why. Transportation was the reason. So now they're waiting for them to start it up again because hopefully they can make it. But so I'm here for 2 reasons, and it's still wonderful, and that's my testimony. Thank you. I'll volunteer. I'll do whatever. I just need a job first. So get that really good.
Thank you. Thank you so much. Let me throw a little tip in. When I first arrived at Dare to Care 3 years ago now, I asked my wife to participate in the Cooking Matters class. I wanted to see what they were really teaching. And they were teaching, in terms of how to cook, and I lost 20 pounds
Wow.
in terms of eating better and just in terms of the way you can do it. So thank you for sharing that testimony. That you didn't have to do that, but you did, and it really helps. So thank you so much.
Wonderful. Amen. That was wonderful. And big shout outs to your wife, Mrs. James, back there. All right, let's go over here to this table. Who's the representative? You look at me in the eye. I think it's you.
They appointed me. I'm Keisha. So we did have a couple of questions. One, I just wanted to, is to Sean, is to dig into the data that you have. That data, that information you have to kind of help propel just the resources that we have. If you can generate that information and get that data out, how are we getting it out? This is some of the first things, of course, we can all Google, but a lot of people just won't do that, especially if they're wiser. If you get where I'm going with that. If they're a little wise, they don't typically want to Google things. So that information is needed. So maybe if they knew, then they would want to do something. Just like you said, if there's some impact, it's big impact, a little impact, that's some impact. Then the other thing is incentivizing. We realize that I have an elite table here. So we have Metro, we have Yum, we have Christ Temple, we have our volunteers here at the choice places. And if you give us an hour, we'll probably figure it out. But Yum says that they have somewhere where they give their employees days off and they pay them to go volunteer. What are some of the corporations are we doing, even the smaller ones, doing to try and get those younger people at JCPS? What can we do with them to get their students to want to do it? Trinity has a program. They're volunteering with Christ Temple now. And why are we looking into those kind of resources to try to get those food and those volunteers, especially if they're aging out? Metro, they're retiring, she said, at younger ages, some 40, depending on where their pension or when they got in. They're retiring early. They still got vitality. What are they doing?
That was really good. You had two good ones, table, over here. So what about incentivizing volunteers to kind of help with the mission? What do you think about that, President?
I think that's incredible. I think it's a great opportunity. And I know, Elaine, can you share a little bit about in terms of just some of the work that you're doing? Because I think people really need to understand, and I won't do it justice. She can really talk about in terms from the way that she has structured volunteerism and the future in terms of some of the things she's thinking about.
Yeah, I'll just briefly share in terms of incentivizing people. You're exactly right. And that's what we want people to understand is really the impact they're making. And so at Dare to Care, we put a lot of thought into that and kind of have a whole calendar and list of ways that we appreciate people. But another thing that I'll share too, and I want to shout out Shane has helped with this as well. Another thing we've started, at least within the Dare to Care network, is a space where we meet quarterly and talk about how to work with volunteers. How are we retaining them? How are we recruiting them? And what are some of those strategies that people are using? So it's very much just a community open forum where we brainstorm, we share ideas, what's working, what isn't, because so much of our time that we are spending is going into making sure our people feel really connected to the mission. They understand the impact they're having because that's what keeps them to come in the first place and keeps them coming back. So there's lots that we do with that, anything from fun events and ways that we engage people, but a lot of it's when we have a captive audience and we're all together, making sure they understand that full story. But more to come from the new quarterly kind of gatherings that we're doing to really put all those amazing brains together to share those wonderful ideas on how to incentivize people.
And the other question, how do you get information out to people who aren't tech savvy? How do you get some of this information out to our seasoned citizens?
I'm sorry.
She had the question of that there are some older, seasoned citizens in our community who don't utilize the internet. Is that what you were saying? And so how to get this information out to them. Is that correct? Great.
One of the things, we just had a pilot that with DoorDash, and we were actually delivering senior boxes, delivering to homes. We also found out through the pilot, and that's the purpose of the pilot, that it's really not economically feasible to be able to do that in terms of working with a partner like DoorDash. But that's not dissing them, but it's just not practical in terms of what all the barriers that we saw with them. So thinking about a way in terms of how we could really think in terms of differently of ways of transportation, because that's huge, and also creating access. We just put together our opportunity in terms of a way we're going to be addressing it based on this data, based on all the work that we've been doing through the Humana Foundation. And so you will be hearing more about that.
All right, thank you so much. All right, let's go to this table. Beautiful, go ahead.
It was almost as if you planned the introduction. I'm Kenny Winchester. I'm with Humana Foundation, and my table didn't know that. So first, I'd like to say on behalf of Humana Foundation, we are so pleased to be a partner with Dare to Care. When we started working with them on this grant in 2022, took a lot of planning. But one of the things that we were most interested in was understanding this data. And we can invest. We get a lot of applications. I'm sure a lot of you all know that Humana Foundation gets a lot of applications, so we can't fund them all. So we try to be very, very critical in our approach to grant making while also being equitable and making sure that the grants that we are providing are going to reach those most in need. And we were able to do that with Dare to Care. This specific project, we are most interested in the data. We are interested as a foundation in nutrition and making sure that when people are receiving food at food banks or anywhere really, that they can receive not just food, but food that fuels their bodies, that allows them to be able to lead healthier lives. And we are committed to that with our partners with Dare to Care. And so we want to thank you. We're excited so much to hear about this. So with that in mind, my table did not know I was with Humana Foundation. And the questions that we have are about the survey. And so it's a two, okay, so the first question is, the question is, looking at the data doesn't seem to be reflective of the communities that people at our table work or live in. And so we're really interested if you are able to break this information down by zip code and additional demographics and how you plan to reach those who are not represented in the survey.
So I'll take the second part first. So can we break it down by zip code? I'd maybe say, have we broken it down by zip code and have we broken it down by region? The answer is absolutely yes. And I'd like to talk a little bit more maybe offline about the concern that it's not representative because I want to understand where that gap is. If there's a perceived gap, I want to understand where that is and I want to make sure we close it because we're not done. There's an entire wave 3. And I have opinions about where it's strong and where it's weak, but they may not align with your all's opinions on where it's strong and where it's weak. And I'd sure like to know seriously where you guys think it's weak, and let's make sure we get that fixed because I don't want to be the arrogant guy and have gaps because of arrogance. So if you guys are okay with it, I'd love to connect after the panel discussion, and let's just make sure. My team, by the way, is over here, and so Vince, Margot, let's get together with those guys afterwards, and let's make sure we have that conversation. If you guys are okay with that. You guys good with that?
Yeah.
Okay, thank you. And we'll make sure it's covered because we don't want gaps. I mean, that's the thing, right? So we don't want to have gaps, so we'll cover it.
I love that. That's what this is all about. All right, moving on to our next table, Dr. Lucrease Kidd.
Hello. So a question that came up has to do with what is Dare to Care doing in terms of partnering with local or regional farmers or building your own farms. So, yeah.
Did you get the question?
Yes. A couple of things in terms of what we're doing. We actually purchase from local farmers. We purchase some of our produce. We have various products. One of the things I will say is that we have even a greater opportunity to do more because I think that helps with the ecosystem, food ecosystem, in which we have to be able to support local farmers. I don't think we do it as not only as Dare to Care, I don't think we do it as well as a community to support local farmers. And so that is something that we are very interested in doing and how we can even be more effective in doing so. As a matter of fact, we are in the process now of going through a strategic planning process. And part of that is in terms of asking questions in terms of how can we do that? Because that is part of something that's so critical in that local farmer, as well as opportunities to have neighborhood gardens, being able to really explore those opportunities that already exist. There are communities, there's groups of folks that already provide that. I think it's an opportunity, again, to address that specifically food insecurity in community is grow your own.
Grow your own. I like that. All right, we're going to make an exception because this gentleman here, you had your hand up earlier when I was taking questions. So make it speedy.
Every time I come to an event like this, make it speedy. One thing that I'm concerned with as a musician, and I've opened some shows for some very important people, and I've been a musical coordinator for certain things, and we had volunteers, and I won't mention the organization, but I felt like the volunteers should have been paid because of their heart. If you got a heart, you can pay them. Second of all, I have a lot of things in my head running through here because of the way I was brought up from Jackson, Mississippi to Chicago about how to do this thing and diversify the money that is given. If you look at the money that's coming in, there's a lot of things that you can do that you're not doing. And I'm looking at things that we're not doing and some of the things that you are. And so the next time that you all have something like this, have it long enough to where we can call some of the farmers to come in here because a lot of them are throwing away stuff. They're throwing away a lot of stuff. So it's not enough time, but if it was enough time, I would hit on some things that would help Delta Care rather than hurt them. Thank you.
All right, this table right here is the representative. All right, great.
Oh yeah, I didn't know if I had to stand up or not. My question is for Ozzy. We spoke a lot about the access and needs, mostly transportation-wise, and I know a lot of local nonprofits and food pantries, also Delta Care, they explained it as well. How can we build a better partnership, or what is y'all capacity to help with the transportation needs? The example that the faith leader gave, excuse me, I forgot your name, so, but with the children, or the mother with the children, I want to say like 2/3 of our clients is that a prime example, and usually like if we have an elder, like consistent elderly, if their daughters or sons aren't bringing them, they don't come or they're walking, and usually they can't take as much food back, or we're trying to use our transportation outside of our job to make sure they can get food back, because we give out surveys as well. And of course, like he said, there's plenty of layers to break down of variables that we need to address, but the transportation seems to be one of the most impactful ones. Maybe if we could attack that first, they could cut out a large percentage of problems.
Yep. So there is cities out there that do stuff called micro-transit and on-demand service. And a lot of that is used for areas that people don't have access to the fixed routes. All right, that does come with a price tag, but that is one of the options that other cities are looking at. We're looking at it. We did two pilot projects here. We did one in J-Town. We did one in New Albany, just to see what it would cost and how that would work. So, that is definitely something that could take further conversation of how our community could best use that. Sometimes that goes from what we call door to door, or that would go for, we would take somebody that can't get to a fixed route that lives too far away to the fixed route, and then vice versa, take them back. So if the consensus is that the issue is, people are not using TARP because we're taking home more product, than we can carry, we just have to, I need to know more about what are they taking out a box and they got kids to deal with? That's definitely a concern. So I don't know immediately how I could help them with that, other than a longer term plan is if there was some partnerships formed with other agencies that need to get people to the doctor that could use a microtransit or on-demand service. So it happens in other cities. It does have a price tag, but it's something we probably should consider and tie it more into numerous things for people that don't have transportation.
All right, great question. Just 2 tables left.
Good job.
Hey, so our table is comprised of some people that are doing either some kind of adjacent kind of data collection efforts or people who are serving community directly and kind of seeing some of the similar things. So one of the things that we talked about was kind of the full spectrum of what I would call food insecurity, right? So we talked about transportation. We also talked about the fact that we rely so heavily on transportation because there aren't grocery stores in every community that are walkable, right? So really just the data around transportation stuck out to our table a lot. And we were just interested if there's space, if we could expand a little bit, maybe kind of cutting down some of those layers, because it also sounds like a lot of people are interested in that transportation data piece.
Thank you.
Yeah, I mean, from his study, I mean, it was 49% of the people have a car. And from talking to him, that doesn't mean they have a car. They could have a moped.
Well, and they could jump in. If you don't
Jump in, we'll share the mic.
Share the mic, exactly. Yeah, so I'll just give a couple of pieces just to reflect on the transportation because that in and of itself is complex and I'm not going to be able to remember all the stats. But it is kind of interesting because the people, it's about half who have a car or who have access to a car. So maybe another family member, another community member is driving them in. But what was interesting is when we would talk like at the focus groups, and a lot of people at the focus groups, that's the reason that we did them in those different locations because we wanted to hit the neighborhood because a lot of people were walking to those focus groups. But it was interesting because we'd start to talk to people and we'd say, well, talk to us about transportation. Is transportation an issue? And I remember this one lady and she goes, well, no, transportation is not a problem for me. She goes, because I've got a moped. Now, we were doing these focus groups back in August. Now, it's February, right? I mean, we know the rest of the story. But even back in August, right? I mean, if she's given a food box, I mean, I don't know how easy it'd be to get a moped with the food box home. So when we start talking about the definition of transportation, that becomes complex. But I think it also bears a sort of acknowledgement that our definition of transportation is not universal. Because my definition of transportation is a car. And I would not have even thought about a moped. And that was not that woman's reality. That was not her reflection. So all of those things come in. There's more to it, but yeah, there's a lot. And in best case scenario, half the people have access to a vehicle, and that's a pretty broad statement, which means half the people don't.
Yeah, and what I would say is, if there was a way for you to tell me out of the 50% people that don't have transportation, and you could break that down based on, I don't use TARC because I have too many packages, or I don't use TARC because I don't know where the stops are, we could grab the low-hanging fruit, no pun intended, and be able to knock out maybe half of that. If we create maps and we show people and we can give them a TARC map that actually has where all our stops are, where all the food pantry operators are, and see how many people would be left.
Well, and when we talk about that lack of information, it isn't just access to the food pantries.
Right.
It's lack of transportation to get to the food pantries. I mean, it's all interwoven.
Yeah, that would help me a little bit.
Well, I have a question real quick. Well, just a statement. You know, you talk about the moped, but my daughter is in college, and I know a lot of times when she gets food from the food hall and she has to ride her moped back to her apartment, she'll put stuff in a backpack. So have you ever thought about doing like a reusable, bag that people can, kind of carry like a backpack that can have capacity to fit a lot of items in there?
Yeah, that's something that I observed actually with our mobile pantries. Our mobile pantries were really set up in areas where we don't have a partner. And it gives us an opportunity to build relationships in that community, but also to identify someone in that community that may be interested in being a partner. But one of the things I observed was folks coming up and didn't have anything. They were walking up the street and literally we're picking boxes, we're trying to scrabble to get this and that. But I think it's an opportunity too, as well as to be able to think about as we're doing these mobile pantries, how do we provide them access to being able to have something that's mobile? We haven't figured that out yet. I know some smart people in this room, so if you got some ideas, please share them And I'm so glad to see Deputy Mayor Nicole George here. Thank you for being here today. And the reason I bring that up is because I think we have some real synergy and some partnerships that can really emerge from this that can address a lot of these problems here with TARC. We have the data, and we have other folks that are here. And I think this is really the power behind a meeting like this, that we don't just walk away with a lot of information, but we walk away with action. And Dr. Mullins will be closing us out pretty soon. And I want to take my hat off to her and tip it in a symbolic way, because she is the brains behind all of this work that has gone forth with this data and being able to think about how we use data more effectively at Dare to Care. She has a team of 2 that are really driving a lot of the project work, but she's done an incredible job in building all this together. So I want to thank her as well.
Yes, Ursula, you are great. I'm Margot. I'm from IQS Research, as Sean mentioned. We were having such a good discussion. We didn't really plan a question. So if you guys don't like my question, I'm sorry. I think it's pretty good. So Shane, I was struck when you mentioned the huge increase that there's been in the need for the food deliveries. But it's not so surprising when you think about it. You hear about all the layoffs and inflation, the job market. So there's all these people, there's more and more people every day who need these services, who have never needed it before maybe, and they're just not familiar with this whole world of using a food pantry, right? So for anybody on the panel, how do you connect with these people, make sure that they know what is available?
One thing that you'll notice, if you go to Dare to Care's website, I know we got to look at it, they're coming up with more and more creative ways for you to get on the website, type in your address, and then figure out where locations near you are, and then have access to their operating hours and different things like that. So I do know that Dare to Care has made some strides in making it easier for me, because there are times that we get people that are from a community that's further away. And we do not limit by zip code, so we will serve any zip code. We don't care where you came from. But if we know that there is a pantry that's closer to you and it's going to save you gas and time, then we can refer people to the website. They can get on there and navigate that and figure out a location that's closer. And so I don't know if that answers your question.
All right. And going to end with Dr. Mullins' table. You did it, Dr. Ursula. Did you enjoy today's event? She's the brainchild behind it. So did your table have a question? And then you've got the last word, sis. All right. He's shooing the way.
Kevin's with public health, and he just asked, what can Metro Public Health do to partner with us on this journey, which was a great question, and we're going to exchange information to do that. So thank you. And thanks, everybody. I guess I won't talk with my back to everyone. Thank you all for coming out. We are so, so grateful to see all of your faces, and we consider you all friends. And this conversation is so important. It is one of the first ones we've been able to have since I've been here in the 3 years, but it's certainly not the last. So thank you so much. We appreciate it. A couple things that I want to do. I know a lot of people were like, oh, we're going to bring people together to talk about data. Like, what is that? Who's going to come? And my answer is you all did. So thank you. But a lot of people want to know, what is the so what? And I think one of the questions that you asked, Margot, kind of gives you all a hint into what's coming. So as everyone has shared, and thank you again to Humana Foundation and for Kenny being here as the sponsor of this research. But this is not the last of the data that we're collecting. This is kind of a midpoint 2 years in. We do have one more wave coming that Sean talked about. And that research is all about kind of the question that you were asking, Margot, which is who are the people that we are not reaching? So we are studying and really, getting the inquiry into the people who are using the pantries. We call them neighbors, but we also know there's a lot of other people who, because of life circumstances, they have not even heard of Dare to Care and don't know that they can use a food pantry and that there's not a lot of eligibility or anything to do that. So that's what our next wave is. That will be another, couple months. It won't probably be until the fall when we'll get those results. But we are planning on sharing this information out. I think one of our tables asked about that earlier. How do we get this out? So after this event, we will be using social media, and I know the question was about, seniors and older folks who may not do that. Right now, that is the best way for us to get information out, and it's low cost and low investment to get it out to people, and we're asking that you all help us reverberate the message. So we're gonna be sharing some of the data points from this. This is videotaped and will be posted online so other folks can access it. So if you will help other people who are interested in this to access that on our website, that would be great. So there is more to come about the research. We will make sure that when the study is completed, there will be a report for those of you, and I think all of you all are interested in that, you'll be reading it. But what we are asking is that you share it, share something that was interesting today, because what we want to do is build more momentum about folks and understanding that we all have a part we can play in addressing food insecurity. So I am charged to give a call to action. So if you are energized by this conversation and you're wondering what can you do while you wait for us to collect more research, one thing that I would ask that you do is consider volunteering. Dare to Care loves volunteers. Elaine is back there raising the roof. We love volunteers. And I will also say among friends, we have a lot of volunteers. So we would ask, volunteer with us, but if we're not your cup of tea, volunteer with some of our partners. Shane, I don't know, he's probably raising the roof too. We have some 200 pantries alone who could use this kind of mobilization. People like Shane who are out doing the work. Shane came here today after doing some street outreach, doing the work and coming to talk about it. Agencies like this need volunteers, and even pantries and folks who are giving out food who are not quite official partners of ours, they need your help too. I saw a young man back here from Change Today, Change Tomorrow. All of these agencies, we consider this an ecosystem. And, what we might do, someone else is not doing, who one agency is serving, someone else can't serve. But we see us all as having a role in this so that we can cover and fill those gaps. So please consider volunteering. In addition to your hands and your heart, because I know we have your passion, we would also ask for your dollars. At Dare to Care, I can say for us that $1, because of how we can purchase and the way that we've got some hotel value and how we're able to shop in the market, $1 donated to Dare to Care can provide 2 meals. And so I know when we think about food drives, which is what every kid growing up in Louisville or our surrounding area thinks about Dare to Care as food drives. Those are amazing. But the $1 that you spend on that canned good, if you gave it to us, we could provide 2 meals. So those are amazing. They're great for raising awareness. But what we ask you to think about is how can you do a fund drive, right? Where your dollars we will use to spend that, where we can leverage our buying power. So it's not just money for us to keep it. It's just that we've got a little bit more buying power because of the volume that we do. So we would ask that you would consider donating. And again, if it's not to us, that is absolutely amazing. We have so many partners. If you go on our website, you can basically shop a list of our partners. And if there's one that you're interested in or close to you, you can give to them too. That still helps people who need food. Also, on your tables, you will notice some very beautiful red kind of index cards. On that, there's a QR code. Please, there's enough for everyone to take one. Take that with you. What we're doing, and Sean is really in charge of this for us, we're still collecting information, y'all. So we want to know more about types of people, how people are accessing services and who are not. So please, feel free to scan that. You don't have to do it right now. Take it with you. Share it with a loved one. We're going to be posting this as well so that we can get some more community participation. But the work is ongoing, and we're still trying to learn. So please scan the QR code. And then finally, last but not least, as I said, this is not the last time we'll be talking to people. We are also looking to start a neighbor advisory group. So this idea of the voice of the neighbor, it's not a new idea, but we're really just getting our feet wet in this. We have started a partner advisory council, which Shane is the president of that, so that we can get our partners together and listen to them to hear the challenges and opportunities. We are trying to do the same thing with neighbors. And I really appreciate the example that was given here about the hard time that some folks are having when you go to a pantry and you find out that they serve with zip codes. There's so much detail behind that and so much nuance about why some partner agencies do that. And one of the main reasons is capacity, right? So back to the volunteering part. But we would just ask that as you think about these kinds of things, if you are a neighbor who has had lived experience in accessing food pantries, Dare to Care food pantries, we are really trying to collect a list, and we're trying to do this with some dignity so folks don't feel put on the spot. But if you are someone with lived experience or you know someone with lived experience, we are looking to try to start a group of folks who can advise us and walk with us on this journey. What that means, and it's not defined yet because we're still learning, is we're looking for some neighbors who can provide some input for us as we develop policies so we can hear how those policies will be impacting you. When we're looking at ways of doing things and starting things, we want to run that by folks who actually have used or have experience using our food pantries. So that is one of our next goals. To do that, we need to start getting a list of folks. And so we want to do that in a dignified way that honors folks' experience. But if you are one of those people or know someone, we will have a sign-up list outside. You can just put your name and email address, and we will contact you once we start getting some groundwork on that neighbor advisory group. So once again, am I closing this out? Or you? Oh, so there you go. Ready to help? You can go to daretocare.org to volunteer or to donate. You can spread the word. I told you about the next phase. And thank you.